But Dr. Tala, how big of an issue is access to vaccines? I mean, what needs to be done for vaccines to be more readily available to children across the country?
So access to vaccines is really important because we know that not everybody has the same access to healthcare. Not everybody has a pediatrician that they go to, as the CMS director was talking about. You know, people are are more likely to enroll their children in CHIP if they also have insurance. And so we need to make sure that there's vaccines available in as many places as children are present. It would be great to have vaccine clinics at schools for kids who don't have access to healthcare.
One more question on vaccines, and I'd love for Dr. Perrin for you to get in on this as well. I'm wondering how much vaccine hesitancy contributes to larger inequities among children. Dr. Talat first.
Oh, I'm sorry, I thought that was so. For the most part, vaccine hesitancy doesn't seem to be a huge role in pediatric vaccines, with the exception of a couple of vaccines that people are hesitant about. I think most of the kids who are unvaccinated, it has a lot more to do with access. We are seeing rising rates of vaccine hesitancy in the United States for pediatric vaccines, and that is something to be very concerned about and to watch carefully.
Dr. Perrin.
Well, you know, we have a ton of information about vaccines and how incredibly effective they are, as my colleague just said. And the evidence is really very, very strong about the tremendous value of vaccines. On the other hand, there have been many people who have raised questions about the healthcare professions in general and are worried about them. Many of our, especially poor families of color, have a history of bad experiences in the hands of the health profession, and still some hesitancy in believing that what they're getting is the right thing. So I think that does play a role in some of this hesitancy as well.